Hello and welcome to the World Healthcare Congress 2012 Executive Interview Studio. Here with me now is Kathleen S. Neal, and she is with the Integrated Healthcare and Disability Chrysler Group. And Kathleen, thank you very much. I'd like to hear your experience in terms of benefit design, and if you've taken on new approaches this year. I understand that you will look at your design annually to see what adjustments need to be made.
Yes, that's correct. Every year, part of our process is to look at the performance of the two offerings that we have for our employees at Chrysler, to determine how they're performing financially and how they're performing clinically. We will look at other benchmarks in the industry, other plans, other organizations, to make sure that we're delivering the most cost-effective and highest quality plans to our employees.
Any consistent themes in these plans that you're seeing?
Clearly, what we've experienced with, and we do have a little bit of an older workforce, what we're finding is that our employees are not necessarily getting the preventive screenings that they should on a timely basis. So we've increased emphasis on that to ensure that our employees are utilizing preventive screenings appropriately.
So a real push towards education and awareness?
Absolutely. What we feel is important is to educate our employees about the importance of improving their health status, utilizing preventive screenings appropriately, because it's important to be screened on a timely basis. And health education and wellness are very much important conversations that we're having with our employees at Chrysler Group.
Do you find that the workforce employees that you talk with are more keen to get this kind of information, or do you find that there's still resistance towards this?
We do feel that our employees are starting to engage in that conversation a little bit more. There is still some resistance, of course.
Why do you think there is?
I think change sometimes is a little bit uncomfortable for people. They're not always necessarily thinking about health in the same terms that we are. Sometimes they feel that companies sometimes intrude into your personal space when we talk about healthcare. What we did in response to that was we brought on a salaried healthcare advocate who works for one of our insurance carriers, and her job is to have that conversation with our employees so that it's understood that it's a confidential conversation about change and that the company will not necessarily have any visibility to that conversation.
Has that been effective?
Very effective. She's well received. She's working with a group of employees who may be having a health issue themselves, or a family member might be having a health issue, and she's built up a tremendous amount of trust with our employees who need her services. Do
you find that your company has added, there's more complexity in designing your benefits because there's overall uncertainty in the healthcare space right now?
Certainly that plays a role. Chrysler was one of the first adopters of consumer-driven healthcare plans back in the mid-2000s. And like all things consumer-driven, one has to be an informed consumer, and we do try to help our employees understand how to be an informed consumer, to go about purchasing healthcare wisely. And we do find that there is some uncertainty, particularly in a plan that kind of puts you in the driver's seat, and so we try to help them work through that uncertainty.
Okay, very good. Thank you, Kathleen.
Well, you're very welcome. Thank you.
I'm Mabel Jong. Thanks for watching.